I'm here with Katie Pierce, and she's going to introduce herself in a minute. And we're here to talk about who we are, what ALS Focus is, why it's important, and most importantly, we're here to tell you about our new survey that's out right now on genetic testing and genetic counseling.
Hi, I'm Katie. I'm a member of the ALS Focus Patient and Caregiver Advisory Committee. I help assist in making the surveys that we send out through ALS Focus. And as some background, my dad was diagnosed with ALS in 2010 when I was 9 years old, and he passed away last year in April 2023. And so I was one of his primary caregivers from about ages 12 to when I went to college at age 18. Aside from ALS Focus, I help review alternative treatments for ALS Untangled. I am a NEALS research ambassador, and I hope to pursue a PhD and eventually do ALS mechanistic and drug development research.
I'm Amanda. I'm the Associate Director for ALS Focus. I have a background in public health and community engagement, and I live with my dog in Tucson, Arizona. So if you haven't heard about Focus yet, it's an online research program that's run through the ALS Association. ALS Focus surveys happen throughout the year, and they focus on different research topics such as experiences with telehealth, caregiver needs, mobility equipment, clinical trials, and so on. And our goal is to learn as much as possible about your individual experiences, needs, preferences, and all of that throughout the disease journey. So we can take those experiences and amplify them and bring that to the forefront of ALS research, advocacy, and care. People living with ALS, current caregivers, and former caregivers are all eligible to sign up for Focus. You just need to be 18 years old or over and live in the United States. All of our surveys are in English and they're conducted online. Just a couple unique components of ALS Focus research. Our program is driven by people living with ALS and caregivers who participate in our Patient and Caregiver Advisory Committee, like Katie, we call this the PCAC. The PCAC helps us select research topics. They design and review research questions, test our surveys for accessibility, and help with recruiting participants into the research study. This helps us stay grounded in issues that are the most pressing to the ALS community. We also have partners from academic universities, federal government, industry, and all of those people bring expertise into this research program. Data from our focus surveys can then be used to inform our programs at the ALS Association, but also beyond. It can inform policies that are going on, as well as ongoing research and clinical trials. And I'll give an example. A few months ago, there was one of our employees who works for in the Texas area. She gave testimony in front of the Texas Governor's Committee on People with Disabilities. She used ALS Focus data on communication devices in her testimony, and that led to a relationship with that committee. And it also has led to shorter wait times for communication vouchers in Texas. This is the kind of important impact that we want our data to have, and the more people we have participating in your state, the more powerful our research can be. De-identified focus data files are available to the public and ALS researchers for free. We foster open science in order to make those discoveries in ALS research happen faster. The data we collect is all kept secure and confidential. We're reviewed by an institutional review board that makes sure our policies and our infrastructure for protecting your information is very rigorous. All of our data files are de-identified, which just means your name, your email is not connected to your survey responses when we share the data.
So why is ALS Focus important? We need you to participate to ensure that we are collecting data that is representative of the entire ALS community. Only you can share your individual experiences with ALS. We want to bring your experiences to the center of all conversations around ALS. The more people we can get registered for Focus, the more responsive, accurate, and influential our research can be. This is an avenue for people to share their needs and perspectives in ways that impact advocacy efforts, care services programs, policy, clinical trials, and more.
All right, so hopefully after hearing this, you're excited to sign up for Focus, and you can go to alsfocus.org and you click the big red button that says Take ALS Focus Surveys. You provide your email and the surveys start going directly to your email. We don't send you a bunch of spam, we only send information about the surveys, we have a different topic twice a year. And if you can't remember if you've registered in the past or not, you can still go through this process, and when you put in your email, it'll tell you if you're up to date. I'm going to go quickly through some of this since we're short on time. This just shows some of our past research topics. I know it's a long list because we've conducted over 10 different surveys. We've had over 3,000 people participate in ALS Focus surveys. Our last survey had over 1,000 people responding to it, which is one of the largest social science research surveys on ALS out there.
We have a new survey that was sent out last month and will be open until November 15th, so register now. We're very excited to announce that we are doing this survey on genetic testing and counseling. We know the decision about whether or not to get a genetic test is very personal. The ALS Focus Genetic Testing and Counseling Survey will ask about why some people with ALS decide to get genetic testing or counseling and others choose not to. With the data collected in this survey, we hope to inform future communication and advocacy efforts around genetic testing and counseling in the ALS community. This survey takes about 15 minutes to complete. People living with ALS and proxies who are designated to answer on behalf of someone with ALS are eligible to complete this survey. No prior experience with genetic testing or genetic counseling is necessary. You can sign up at alsfocus.org or by using this QR code. Though current and past caregivers are able to join ALS Focus anytime, this particular survey is only for people living with ALS and proxies. There will be future surveys open to caregivers.
So please try to sign up before November 15th so you can have your perspective shared about genetic testing and counseling before that survey closes. And there are a lot of things that we've learned from past surveys. We don't have a lot of time to go through this, so I'll just name a few things. We've learned that about 25% of people living with ALS and caregivers have experienced debt or had to borrow money due to ALS treatment and caregiving. And we've learned that 1 in 3 people who've submitted a claim or a prior authorization to their insurance have had ALS care denied, and that prescription medications are one of the most commonly denied care services by insurance. So maybe this reflects some of your own experiences. With the focus surveys, we have numbers and data behind these experiences that allows us to take action on important issues. And I'll explain how we do that. So some of our, we've had many impacts in the ALS space. In 2022, the ALS Association submitted ALS-focused data and public comments to the Centers for Medicare and Medicaid Services using focused data on power C elevation when Medicare was assessing the evidence to determine whether or not they should cover that, and they did eventually decide to cover that. So we're really glad that we were able to provide those numbers and the data to show how important this is. Also, all of our focus survey results and our public data files have been shared with the National Academies of Sciences, Engineering, and Medicine Committee for their study on accelerating treatments and improving quality of life in ALS. So this is a way that our research is paired with other research in order to give a holistic perspective on ALS. So thank you for being here with us right before lunch and hearing about this. We really encourage you to sign up for Focus and take our genetic testing and counseling survey. This work is so crucial for making sure that your perspectives are included in research and policies and care services. And we need to learn from you. There's a lot of power in numbers, so the more people we hear from on the survey, the more power the data can have, especially in your state. Finally, I just want to thank the many people who dedicate their time and resources to Focus, including our amazing advisory and our steering committees, our partners, industry sponsors, and of course, our ALS Focus participants. And I think we're ready to take questions now.
Are there any questions either on the Focus survey or the ALS National Survey? Just because we kind of combine those topics. If you have a question, we're also happy to answer questions at the table as well, but want to make sure we give an opportunity. Okay. All right. Well, it's never too late, so find one of us if there's any questions.